Hello, my dear CAR alumni. I've studied in UC Berkeley from 1992 to 1998. Now, I'm serving my country as a Minister of Health and Welfare. Thank you very much for presenting me the opportunity to speak in the reunion and the Parents' Weekend at the homecoming. I will notice that the theme of my today's lecture has been introduced as a firm foothold for economic and social welfare in the UC Berkeley's homecoming webpage. These things I learned, experienced, and researched in UC Berkeley have laid a solid foundation for me to grow as a researcher, professor, and minister. The key values UC Berkeley has taught me were inclusiveness and innovation. Like the rest of the world, Korea is fiercely battling the COVID-19 while endeavoring to overcome our own domestic socio-economic challenges, such as polarization and the low fertility rate. Today, I would like to talk about how the two values, inclusiveness and innovation, have supported Korea to overcome multiple challenges. First, I want to talk about what the Ministry of Health and Welfare of Korea is doing to become an inclusive welfare state. On this slide, you can see the major indicators of Korea in 2016. This is before Korea aimed to become an inclusive welfare state. Korea was a relatively wealthy country, but the people's quality of life was not as high as one might expect. No matter how hard one works, polarization in Korean society was exacerbating because incomes were not fairly distributed. In particular, issues regarding elderly poverty and unemployment have been the worst of all. In addition, as the younger generations didn't have high hope for the future, they were choosing not to have children. To make matters worse, the Korean economy was projected to hit its limit because of social challenges such as population aging. So, to overcome those socio-economic issues, Korea has been engaged in discussions to become an inclusive welfare state on the basis of inclusiveness and innovation. Our goal was to provide a safety net for the people and achieve economic growth by realizing the values of inclusiveness, creativity, and innovation. An inclusive welfare state seeks to guarantee basic standard of living to all citizens and allows individuals to unleash their full potential. Opportunities from economic growth will be given to people in all socio-economic levels, and the wealth generated from the growth will be fairly distributed across society. As a result, the people's quality of life will be improved, allowing them to enjoy much happier lives. Since reasonable expenditure on welfare is linked to education and technological innovation, Korea believes it will also have a positive impact on economy and employment. With this mechanism in mind, we have decided to pursue becoming an inclusive welfare state, which is a state with a sustainable growth model where all benefits of growth is fairly distributed across society, where individuals' capabilities are strengthened, resulting in another economic growth. Out of all the ministries in Korea, my ministry will have to play a key role for Korea to become an inclusive welfare state. The Ministry of Health and Welfare covers a wide range of issues, from guaranteeing basic living to solving demographic issues. In the Beveridge report, the expression from the cradle to the grave is used. As the expression suggests, my minister is in charge of protecting the people of Korea from pregnancy to death. To guarantee basic living, the needs of the people should be identified first by assessing the life cycle of the people and the demographic characteristics of the state. The Ministry of Health and Welfare started to take concrete steps towards inclusive welfare state ever since the current government took office in 2017. In 2017, just a few months after President Moon took office, the Korean government announced policies to expand the coverage level of health insurance and the nation's responsibility for dementia. It was an effort made by the government to make sure more people can receive the benefits of healthcare policies. Our policy on expanding the coverage level of the health insurance eases the financial burden of medical bills and makes medical services more accessible. The government providing disaster relief for medical bills during these challenging times is also part of this policy. Our policy on strengthening national responsibility for dementia is a comprehensive support system for dementia patients. It covers dementia-related medical services, including early detection, prevention, consultation, case management, and medical care. The government has also announced the plans to increase the necessary services in the child care, nursing, medical, and the cultural sector, and add 340,000 jobs to the social services industry by 2022. From July 2018, Korean government have provided child allowance of 100,000 Korean won each month for households with children under the age of 6 and have extended the age of eligibility for child allowance to children under the age of 8 in 2019. The government have announced our aim to strengthen public health system to allow all people to have better access to medical services regardless of their location, income, and illness. Korea have adopted the multidisciplinary public health collaborative approach, One Health, to take a comprehensive action against elements detrimental to the human health, such as novel infectious disease, food safety risks, fine dust, and toxic chemical substances. In 2019, Ministry of Health and Welfare launched a comprehensive community care project and adopted a new social services support system called Public Agency for Social Service. These policies were implemented to innovate the current social service system, which were led by private institutions and mainly focused on in-facility care. My minister wanted to build a health system that allows people to receive a sufficient care and medical services near their homes. Korean government also aimed to improve the accessibility and the quality of social services through public agencies for social service, which are run by local governments. Furthermore, the government have repealed the disability rating system, which provided different levels of social services depending on the disability rating scale. Instead, the government have reformed the support system for the disabled to surveying what services each person with disability needs. Based on the outcome of the survey, the system is providing customized services to each individual with disabilities. This year, Korean government reached a major decision in reassuring our commitments to become an inclusive welfare state. First, the government have made the decision to no longer take the income of the mandatory caregiver into consideration when determining who are eligible for the guaranteed minimum income. Also, to normalize staying home when sick, the government is proposing to adopt accident and sickness benefit. Recognizing the necessity of a non-face-to-face medical and healthcare services from the COVID-19 pandemic, the government has decided to foster digital health services such as smart hospitals that incorporates 5G IoT and other digital technologies and digital care that are supported by IoT sensors and the AI speaker. 3 years may be a short period of time, but the Ministry of Health and Welfare has achieved tangible results from our efforts to become an inclusive welfare state during the last 3 years. The latest data are not in yet, but if we look at our performance in Gini's coefficient, elderly poverty rate, child deaths from accidents, health insurance coverage in 2019, we can see that Korea is gradually improving in areas of income distribution, child protection, and medical coverage. The efforts of my minister have also been recognized by the people of Korea. According to the monthly poll survey conducted by a newspaper outlet on the people's approval rating on Korea's 18 ministries, the Ministry of Health and Welfare has ranked number 1 for 14 consecutive months since the survey was first conducted on July 2019. This shows that the Korean people are also highly optimistic about our efforts to realize the values of inclusiveness and innovation through social policies. As the Minister of Health and Welfare of Korea, and as a Berkeley alumni who have encountered these values in our campus, I'm extremely proud. But there are still room for improvement. One area Korea is still struggling on is low fertility rate. Even after implementing our inclusive welfare policies, Korea's fertility rate is continuing to fall. Low fertility rate in Korea shows that the quality of life of Korean people is not high enough. In the past, childbirth and child care have been our sole focus when designing policies to counter low fertility rate. It's now time to take a different approach. Korean government needed to take a holistic approach which factors in elements such as child care, gender equality, education, and housing. These necessities should be guaranteed throughout the people's lifetime. This new approach would make Korea a country where people would be happy to live in. Then the low fertility rate issue would be solved by itself. Inclusiveness and innovation have also been a key drive in our battle against COVID-19. Allow me to explain how. COVID-19 is a novel infectious disease, and that is why we are still in the process of learning its clinical characteristics. What we know so far is that the virus is highly contagious and its mortality rate is not as low as initially predicted. As of September 2020, there are over 30 million confirmed cases across 184 countries, and over 1 million people have lost their lives. The whole world is going through chaotic times because of COVID-19. COVID-19 case was first confirmed in Korea on January 20th. In February, there was a spike in confirmed cases around Daegu and the Gyeongbuk province. Then the spread was slowed by March. Again, in August, there was a jump in confirmed cases, this time around the Seoul metropolitan area, but it was stabilized by September. In February, when we've slowed the spread of COVID-19, Korea's COVID-19 prevention and control measures were recognized by the international society. The foreign media have reported that voluntary participation of the citizens, the people of Korea's mature sense of citizenship, and the integration of rapid diagnostic tests and IT mobile technology have made Korea an exemplary country in COVID-19 prevention and control. Out of all the OECD member states, Korea was least affected by the COVID-19 in terms of economic decline and the number of deaths. As you see from the graph on this slide, although it's minus growth rate, we have the highest GDP growth rate and the lowest number of COVID deaths per 1 million among OECD countries. Also, we can see that countries with low COVID deaths tended to have suffered less economic impact. This proves that Korea's COVID-19 prevention and control measures have also shielded our economy. Like I've mentioned before, the spirit of inclusiveness and innovation were the foundation to Korea's COVID-19 control measures. Even when Korea have put our utmost effort on control measures, in the spirit of inclusiveness, Korean government have worked hard to make sure people can continue their everyday life as much as possible. Innovative measures such as a special entry procedure, residential treatment center, and the drive-through screening stations were all part of our efforts to realize the value of inclusiveness. Korea is making sure no one is left behind. Health system based on national health insurance, advanced ICT technology, mature sense of citizenship have all played a part in our successful control measures. I will talk about each element that have made a positive contribution to Korea's rapid and effective control measures. First, the Korean National Health Insurance System. The National Health Insurance System serves all Korean citizens. The system covered all testing and treatment costs for COVID-19 from the very first confirmed case. The costs from residential treatment centers, which are in charge of treating patients with mild symptoms, are all also fully covered by the National Health Insurance, even though the centers are not official medical institutions. The system not only allows all patients to be treated without any financial burden, but is also greatly contributing in efficient contact tracing. Also, private medical institutions are adding support to the COVID-19 response by actively participating in testing and treatment and functioning as public medical institutions. Second, the Korean people's elevated level of trust in government due to the transparent information sharing. The government conducts 2 regular briefings each day to deliver more accurate information and the relevant policies on the infectious disease to the people of Korea. In particular, Korean government have made sure no religion or sexual identity is discriminated during control measures so that all confirmed patients will candidly disclose their whereabouts and cooperate with the government. And the people of Korea greatly appreciated the government's efforts. Social distancing and other preventive measures are strictly followed, and some even did volunteer to support the government's work. Because of the communication and the collaboration of the government and the people, Korea is relatively doing well in controlling the COVID-19 outbreak. Third, an upgraded screening system called Special Entry Procedure. This procedure was adopted to ensure movement and exchange while blocking the virus from entering our country. Initially, screening was only conducted in airport quarantine stations, but now all travelers, both Korean and foreign nationals, are monitored and traced for 2 weeks upon arrival. All travelers are required to download the self-diagnosis mobile application and record their health status each day. Korean government have built a network so that the entrants can be connected to a medical institution when they show signs of alarming symptoms and don't update their status. Fourth, early diagnosis. Korea has manufactured diagnostic test kits in advance and established drive-through screening stations and walk-through screening stations to aggressively conduct COVID-19 tests. In particular, drive-through screening stations were the catalyst in introducing Korea's efficient and safe diagnostic tests to the world. It is still recorded as one of the best practices of COVID-19 response. Fifth, residential treatment centers. Although COVID-19 is highly contagious, most COVID-19 patients present mild symptoms. Taking this into consideration, Korea has established residential treatment centers to treat COVID-19 patients with mild symptoms in isolation, and the patients with severe symptoms are hospitalized in negative pressure rooms of the infectious disease hospitals. This arrangement was first implemented to solve the issues of hospital bed shortages. In February, when a single region experienced a spike in confirmed cases, insufficient hospital beds have become an issue in Korea. Some people passed away in their homes while waiting for hospital bed. Ever since the adoption of the residential treatment centers, the wait lists for hospital bed dropped from 2,200 people to 500 people per week in March 6th. I believe the use of a residential treatment center has played a major role in lowering the fatality rate of COVID-19. Our rapid ICT-powered epidemiological investigation is also another major aspect to Korea's response to COVID-19. Epidemiological investigators track mobile records, credit card bills, and surveillance cameras to swiftly learn the travel route of the confirmed patients and trace contacts. Disclosing the travel route of confirmed patients is the fastest way to seek out contacts, but we have always safely protected the personal information of the patients. The government have refrained from disclosing sensitive information and dispose all information after 14-day period. However, despite our successful control measures in the early stages of the pandemic, just like any other countries, the number of confirmed cases is still growing in Korea. Confirmed cases with unknown transmission route could be the seed to another disastrous outcomes. The people, health workers, and the disease control authorities are all fiercely battling on COVID-19, but as the battle is getting longer, they are getting exhausted. There are also other external threats we must remain vigilant for, such as influenza virus, making us feel like we are walking on thin ice. Today, many countries and pharmaceutical companies are racing to develop and distribute COVID-19 therapeutics and vaccines. There are also signs of international collaboration on treatments and vaccine development. For example, a global initiative on vaccine and treatment development called the COVAX Facility, which is led by Gavi, has been launched. As the COVID-19 pandemic is lasting longer than expected, finding ways to control the disease while shielding our economy and everyday life will be a challenge all countries must face until we are free from COVID-19. The development of therapeutics and vaccines are now in the hands of the medical experts. However, deciding how we should distribute them, how we should decide the priority groups, and how we should overcome the multiple conflicts and chaos regarding vaccines are the questions the international society must solve together. I believe the answer to these questions can be found in the values of inclusiveness and innovation. Embracing inclusiveness and innovation is also the first step towards balancing COVID-19 control, people's everyday life, and economic growth. So far, I've mentioned that Korea is currently a leader in the COVID-19 control and economic growth. I also said that the spirit of inclusiveness and innovation are the driving force of Korea's many policies and measures. Lastly, I talked about how Korea is tackling domestic social economic challenges as well as infectious disease by harnessing social policies and disease control measures centered on inclusiveness and innovation. It was a great honor for me to be at the forefront of all the milestones Korea has reached as the Minister of Health and Welfare. All my contributions and achievements made in Korea have rooted from the two values usually engraved in my heart. I would like to once again express my sincerest gratitude to UC Berkeley for teaching me values I will forever cherish and for giving me the opportunity to speak in this prestigious event. Thank you very much for your attention.